Welcome back, guys. Today we are going to see the nursing management of severe malaria. In each and every management you need to start with history taking. The history will guide you and will make you to know what to start with and what to do. So in our history taking, we are going to take the name, the age, the sex. We are going to get the information about the residence of the person, like village, parish, sub-county, county, and the district. And then after that, we are going to come to complain of the patients, what the patients will complain of. The patient will tell you fever, this one will be high grade, then joint pain, headache, passing bloody urine, convulsion, and consciousness. And then on your examination, what you are going to do, palpation, or anyway, general examination, you'll get hepatosplenomegaly, enlargement of the spleen and the liver. You are going to get the low glucose level, RBS, and then you're going to see the severe pallor, and then someone will be jaundice, respiratory distress. Then you check the SpO2 will be low, and then you do your observation. That one, the vital observation, TPR, temperature, pulse, BP, and respiration. So these are the first step. Then we come to the actual management now. In nursing management of severe malaria, complicated malaria is emergency. It's a medical emergency and you need to work as a team. You alone cannot. What will be your aim from here according to the history you have seen or you have taken? Your aim will be to improve the tissue perfusion because the SpO2 is low and the person is having respiratory distress, and then to regain the normal HB level because you see the pallor, and then to restore the normal body temperature. Someone is having fever, and then to prevent further damage of organ, then to eradicate the Plasmodium parasite in the body. And then what are we going to do here? We are going to admit this patient quickly in emergency unit. We are going to put in the position which the condition permit. If someone is having respiratory distress, we are going to put in a sitting up. And then if someone is unconscious or convulsing, we are going to put in recovery position depending on the condition, because not all the patients with severe malaria will present with the same symptoms. And then after putting in the position, reassurance is throughout. We will reassure the attendant, and if the patient is conscious, also reassure the patient. Then we manage the danger signs which is going to put the patients into problem very fast. And then what are those signs? One, we are going to manage hypoglycemia by giving glucose. In children, if this one is a child, we are going to give 5 mils per kilogram body weight. And then we are going to put this child on oxygen. For convulsion, we are going to give IV dieaese pump, 0.2 milligram per kilogram body weight. And then we are going to manage the temperature by giving rectal PCM or rectal diclofenac. In adult, we are going to give IM diclofenac. And then from here, we are going to take emergency sample for blood grouping and cross-matching. Remember, you will work as a team. When the sample is taken, you need to book blood if the patient has low HB. And then make sure that you monitor the vital signs closely. So if you are in a low facility, you give start dose of anti-malarial dose like rectal, artesunate, or IV quinine, and you refer. If you can even remove the sample and accompany the patient to the hospital, you can remove and just hand over the sample to the lab, and they will do the investigation, and if the HB is low, they are going to give the blood to the patient. If you are in the hospital, you need, when you have already stabilized the patients, you need to inform the doctor who will come and order for investigations and prescribe treatment, and can even do LP because of conversion, ruling out meningitis, and will also order for other investigation, ruling out other infection, also order for CBC. And then after the patient is stabilized, you need to transfer the patient to medical ward, where all the other nursing intervention will continue from there, or will continue when you have already stabilized the patient is out of danger. In summary, severe malaria is a medical emergency. So you need to work as a severe malaria is a medical emergency. You need to work as a team. You need to set your aim according to your assessment and history. Then you need to make sure that the patient is out of danger. You start with the sign which will kill the patient first, like start with the airway. You manage hypoglycemia, you manage convulsion, you manage fever, you manage anemia. So that is all. Thank you for watching, and see you in the next one.